Hello there, I'm Dr. Zelda Okia. I am a life and a weight loss coach, and I'm also a forensic pathologist. So as a life and weight loss coach, I work to help people lose weight, feel great, and live their best lives ever. And through life coaching, I also hope to empower people to live their life and make better choices so that they do not wind up on my autopsy table. Anywho, so we're in the month of November, and this past month, October, was actually Breast Cancer Awareness Month. So I did a few talks, and in one of the talks that I did, I spoke about this article that I had found, and it's about Metformin and Cancer. And it says, the title is Metformin and Cancer, an existing drug for cancer prevention and therapy. And this is from the Journal Oncology Letters from 2018. And it's very interesting. When I gave this presentation, there were people in the audience who were overweight and who had diabetes and were not aware of this added benefit of metformin. Metformin is also called glucophage. It's one of the first line treatments that a lot of doctors put their patients on who are diagnosed with type 2 diabetes. So type 2 diabetes, these are typically patients who have elevated insulin levels, as opposed to type 1 diabetics. We may think of that as the juvenile onset, or it's usually in children. Although we are seeing children now with type 2 diabetes, but type 1 diabetics, typically their body doesn't make any insulin or makes very little insulin, so they don't have enough insulin. But it's interesting because this article initially talks about the increased risk of cancer in people that have diabetes. And this has been known since in 1934, there was a researcher who showed an association with diabetes and cancer. And it says over the past 15 years, this association has been increasingly recognized, particularly for endocrinologists and oncologists. And in 2003, there was a paper that came out showing how colon cancer patients with diabetes had higher rates of mortality, which is death, and tumor recurrence. So after someone is treated, the tumor can still come back. And then in 2005, another paper showed a risk of colon cancer that also was increased in patients with type 2 diabetes. And it says, studies have revealed diabetes is recognized as an independent factor, prognostic factor, for colon, pancreatic, breast, liver, and bladder cancers. It says a meta-analysis revealed cancer patients with pre-existing diabetes have increased risk of mortality compared to those without diabetes. So in addition to, I talked about obesity and its association with diabetes, and then other obesity-related conditions, including hypertension, sleep apnea, other respiratory issues, including asthma, arthritis. There are so many other diseases that are associated because someone is overweight or obese, including diabetes. But now there's this added association of diabetes with an increased risk of cancer. That's very significant. And they talk about why people with diabetes are at increased risk. And one of them is this insulin resistance. So as I talked about initially, they have high rates of insulin and also increased levels of insulin-like growth factor. And this insulin-like growth factor actually works in inducing other changes in the cells that lead to cancer growth. So it actually is, we say pro-cancer. It actually gives the cancer, energizes the cancer to continue growing and spreading. The other thing that they talked about was inflammation. And we know that inflammation is associated with an increased risk of cardiovascular disease, but inflammation is also increases what's called the oxidative stress because of the factors, the proteins that are released when someone has inflammation. And we talk, you hear about eating more fruits and vegetables because they have antioxidant effects. Well, that's the thing. The fruits and vegetables help to fight this oxidative stress. And so just having diabetes does make an increased inflammation in the entire body. And then when the body is chronically inflamed, then that person actually becomes somewhat immune deficient. So that's the third factor, is the hypoimmunity or lower immunity in diabetic patients, which then makes it harder for the body to fight these cancer cells, because cells are constantly mutating and turning on genes that drive growth. And really that's what cancer is. It's like just an unhindered growth. And so our body constantly has to fight these cells that kind of become rogue. And so if somebody doesn't have a strong immune system, they become more prone to developing cancers because their body can't fight off these cells. But the metformin, this article goes on to say how metformin, which is also called glucophage, a lot of doctors will put their patients that are diagnosed with type 2 diabetes or even pre-diabetes. I talked to my doctor and I was on metformin for some time before I was able to lose weight. I lost 30 pounds working with a weight loss coach to lose weight, and now I'm living my best life ever. And but this metformin has anti-tumor properties, and they're just saying in this article, recent studies and this meta-analysis have revealed that patients with type 2 diabetes have lower incidence of tumor development than controls. And then the patients that are diagnosed with cancer have lower risk of mortality when treated with metformin. So those of you that might be on metformin, there are some side effects of metformin, some GI, diarrhea. In rare cases, there might be a ketoacidosis. Obviously, if somebody has kidney disease, then that puts them at an increased risk. But for most people, metformin is very well tolerated. Like I said, I was on it, and I didn't have any of the negative symptoms from that. So those of you that are on it and you're a type 2 diabetic, talk to your doctor. You might want to continue that. Or if somebody is pre-diabetic. So for me, I wasn't quite to the level of being a diabetic, but my blood glucose, my fasting blood glucose was elevated. So I talked to my doctor about getting on metformin. Now there's perhaps this added benefit now of the anti-cancer effect of the metformin. So when I gave this presentation, a lot of the people I spoke with were not aware of this response, of this effect of the metformin, that it may help their bodies to either prevent cancer or improve survival if somebody does have cancer. So I just wanted to get that information out in case fewer people are aware of this, and definitely look up this article. It's called Metformin and Cancer, an existing drug for cancer prevention and therapy. But then if you just Google metformin and cancer, there's a lot of information out there. So just be informed, talk to your doctor about it, and just work to advocate for your own health and your own wellness and well-being. And as before, if you are struggling with weight loss, or you'd like to talk more about working with a weight loss coach and living your best life and helping you to make better decisions for yourself, then give me a call, contact me. I'm on Facebook, I'm on Instagram, LinkedIn, and my website is www.zeldaokia.com. So I would love to talk to you more about this or any other issues that you might be dealing with. Have a great weekend. And I've attached a link to a free download. So please have a look at that also. I look forward to hearing from you. Have a great weekend. Bye-bye.